Dr. Smith. Welcome to my teaching module about OB ultrasound. Many of you know that the ultrasound images are kind of cool. You get to see the baby and the heartbeat, and most people want to know whether they're having a boy or a girl. But what is it specifically we're looking for with these ultrasounds? I thought I would explain that very briefly. With the very first ultrasound, usually at about 8 or 9 weeks when you come into the clinic for the first time, we like to measure the crown rump length of the baby because that tells us how many weeks you're pregnant, and that helps us lock in the due date within about 72 hours. Very precise, very accurate. If there's a difference between your last menstrual cycle and the ultrasound, we usually choose the earlier of the two just to be safe. At about 13 weeks, we usually recommend a test called an ultra screen. That also measures the baby, and we do a little finger stick blood test to check some of the proteins that come from the placenta to give us some reassurance that the placenta will function normally through the rest of the pregnancy. And then at 20 weeks, that's when we can usually tell boy or girl. Some people don't want to know, many do, but we want to identify all the baby's structures and make sure they're the right size and they're the right proportion. Later in the pregnancy, after 20 weeks, we're pretty much done, unless later in the pregnancy we're worried that the baby's too big or too small, or how are things going. If the placenta starts to function abnormally and doesn't supply enough oxygen or nutrition to the baby, then the baby will, as a protective measure, shunt more blood flow to protect the brain. And the brain will grow normally, but the rest of the body will be smaller in proportion. And it's that proportion that we sometimes monitor to make sure the baby's growing normally, the placenta is working well. There are some Doppler blood flow parameters we can measure to check on placental function, and I'm going to cover those in the next teaching module about umbilical Doppler flow. Thanks for being with me, and have a safe and happy delivery.